Hello everyone, this is Ashutosh and you're watching Medutainment. So today in this video, we are going to talk about the roof and the floor of the cubital fossa, which is going to be the part 2 in continuation with the part 1. If you haven't watched that video, then please do watch by clicking on the I button. So before starting the video, if you are new on this channel, so please consider subscribing it and hit that notification bell so you don't miss any video like this. Watch the video till end as I have described the topic in very much detail and you will miss if you skip. So without wasting any further time, let's get started. तो आज हम इस वीडियो में बात करने वाले हैं only about the roof and the floor of the cubital fossa as we have discussed about the boundaries earlier in the part 1. And in the upcoming videos, we will discuss about the clinical correlation and also the contents of the cubital fossa. So today in this video, only about the roof and the floor. So let's start. So let's start our discussion on the roof of the cubital fossa, and then later on we will discuss about the floor too. So let's start our discussion on the roof. Here you can appreciate the diagrammatic representation of the roof of the cubital fossa. One by one we will pick up the things what are visible in this pictorial representation. So first is the skin. Skin will be the very first layer in the roof of the cubital fossa. Following this, there will be superficial fascia, and in this superficial fascia we have many of the neurovascular bundles, but mainly we have superficial vessels along with the nerves. So which of the vessels and nerves are there, we will see one by one. So let's discuss first the veins which are located in the superficial fascia. So there are basically three veins in the superficial fascia, and they are as follows. First is the cephalic vein, second is the basilic vein, and third and the most important is the median cubital vein. तो ये तीनों veins कहाँ पे located है? Let's see in this diagram. Here you can see that laterally we have the cephalic vein running here laterally. So laterally we have the cephalic vein, and medially running will be the basilic vein. So medially is the basilic vein and laterally is the cephalic vein. And between these two veins is the medial cubital vein, which is clinically very important, and we will discuss what does it have importance in the clinical correlation of the cubital fossa. So as for now, we have these three veins: cephalic vein laterally, basilic vein medially, and the communicating between them, the vein is median cubital vein. And all of these three veins are located in the superficial fascia. So now let's discuss about the nerves which are located in the superficial fascia. The two nerves which are running along with the veins in the cubital fossa are, the first one is the lateral cutaneous nerve of the forearm, and the next is the medial cutaneous nerve of the forearm. So these are the two nerves running along with the veins. So the lateral cutaneous nerve of the forearm is running along with the cephalic vein, while the medial cutaneous nerve of forearm is running with the basilic vein. So before moving further, let's discuss where these nerves are coming from. So let's discuss about where these two of the nerves coming from. As we know that the brachial plexus is having three of the cords, which are the lateral cord, the posterior cord, and the medial cord, and they are coming from their respective upper, middle, and lower trunk. So lateral cord is coming from the upper trunk, and the lateral cord is having one of the nerves, which is the lateral cutaneous nerve of the forearm, and this nerve is having the root value of C5 to C7, that is to say C5 C6 and C7, and it is a part of upper trunk. And one more thing, this lateral cutaneous nerve of forearm is actually the continuation of the musculocutaneous nerve which is located in the arm. So we can say that this lateral cutaneous nerve of the forearm is actually the sensory branch or sensory branch continuation of the musculocutaneous nerve. So we are done with the lateral cord. Now let's come on to the medial cord. The medial cord is having the nerve, that is to say the medial cutaneous nerve of the forearm, which is actually having the root value of C8T1 as it is coming from the lower trunk. And there in the lateral cord it was having C5 to C7 because it was coming from the upper trunk. So we are clear with these two root values of the cutaneous nerve of the forearm. So medial cord is giving the medial cutaneous nerve of the forearm, which belongs to the lower trunk and having the root value of C8 to T1. So this was the general overview that from where these nerves are coming, and we can also appreciate here that these nerves are actually giving the sensory branches or sensory innervations to the lateral and the medial compartment of the forearm respectively. So now we are cleared that from where these nerves are coming. So now we can locate these nerves here in the cubital fossa. So here we can see that the medial cutaneous nerve of the forearm is actually running with the basilic vein here, and the lateral cutaneous nerve of the forearm is actually running with the cephalic vein. So cephalic vein is laterally, so lateral cutaneous nerve of forearm is actually running with the cephalic vein, while the medial cutaneous nerve of forearm is actually running with the basilic vein. So we can see that these two nerves are running with the respective veins, and they are coming from the brachial plexus and forming the very important part in the cubital fossa. So here we are done with the two structures in the roof of the cubital fossa, that is to say the skin and the superficial fascia, which is having the neurovascular bundles. Next is the deep fascia, and the last but not the least is the bicipital aponeurosis. So bicipital aponeurosis is actually the continuation of the biceps tendon. So let's discuss a little bit more about the bicipital aponeurosis. So let's discuss about the bicipital aponeurosis. It is actually a strong slip which extends medially from the tendon of the biceps to the deep fascia and the subcutaneous posterior border of the ulna. So as we have discussed that it is coming from the biceps tendon and it is extending till the ulna, and it is having a little bit function too, that is to say drawing the posterior border of the ulna medially during the supination of the forearm. So it is also helping in the ulna in the supination. Basically the supination is done by the supinator muscle, but bicipital aponeurosis assists little bit by drawing the medial border of the ulna a little bit medially. I meant to say posterior border of the ulna medially. And one more important clinical correlation of the bicipital aponeurosis is it is presumed to protect the neurovascular bundles in the cubital fossa, which are the median nerve and the brachial artery, which are passing deep to it. So these two structures are passing deep to the bicipital aponeurosis. So they are basically protected by this aponeurosis. So in this pictorial representation, we can appreciate various structures which are located superficially in the cubital fossa. As we have seen, the basilic vein, this is the basilic vein, and this one is the cephalic vein. The next one is this is the medial cutaneous nerve of forearm, which is running along with the basilic vein, right? And with the cephalic vein running is the lateral cutaneous nerve of the forearm. So we can clearly appreciate the structures in this. And one more is this bicipital epineuritis. Yes, which is the continuation of the tendon of the biceps, and which is going to the ulna, posterior border of the ulna. So this is how the structures look in the cubital fossa superficially. So now we are done with the roof of the cubital fossa. So let's discuss about the floor of the cubital fossa. Mainly, the floor of the cubital fossa is actually formed by the two muscles. The first one is the supinator and the next one is the brachialis. So as we have discussed that the floor consists of the two muscles, that is to say the supinator and the brachialis. So let's discuss little bit about the supinator origin insertion as well as the brachialis origin insertion. First one is the supinator muscle. The name says that it helps in the supination of the forearm. So it is taking the origin from the lateral epicondyle of the humerus. Uh, some more origins are also there. That is to say the annular ligament of the superior radioulnar joint. And the third origin is the supinator crest of the ulna and depression anterior to it. So we can say that it is located somewhat medially and also taking origin from the humerus and ultimately getting inserted onto the neck and upper one third of the lateral surface of the shaft of radius, so as to help in the supination of the forearm. And this supinator is getting the innervation by the deep branch of radial nerve. So our next muscle is the brachialis muscle. The brachialis muscle is taking the origin from the lower half of the anterior part of the humerus, and it is getting inserted onto the ulnar tuberosity as well as on the anterior surface of the coronoid process of the ulna. Means ultimately it is going to the ulna. Starting right from the humerus, it is going to the ulna. So this brachialis muscle is considered as the more powerful flexor as compared to the biceps brachia muscle in flexing the elbow joint. So in this diagram of the cubital fossa, we can clearly appreciate the very two contents of the floor, that is to say the supinator and the brachialis muscle. So supinator is located somewhat here, and which helps in the supination and which is forming the floor of the cubital fossa. And the very next muscle is the brachialis muscle, which is located here, coming from the humerus and getting inserted at the ulna. So this is the brachialis here, and this one is the supinator. So these both the muscles are forming the floor of the cubital fossa. So both of these muscles are forming the floor of the cubital fossa. I hope you are cleared with all your queries related to the floor and the roof of the cubital fossa. If it is so, then please give it a big thumbs up and share as much as you can. अगर आपने मेरे चैनल को अभी तक सब्सक्राइब नहीं किया है तो अभी कर दो और नोटिफिकेशन बेल भी हिट कर दो. You can also follow me on various social media handles, links down in the description box. If you have any of the topic suggestions to make video on, then you feel free to comment in the comment section. In the upcoming videos, we are going to see the contents of the cubital fossa, which will be the part 3 of 4. Okay then, see you guys in the next video. Till then, keep watching and keep sharing my videos. So until next time, Ashutosh here, signing off.